but I also want to give you the opportunity to talk about STANA, which you already kind of mentioned. But can you explain again, or maybe in a little bit more detail about STANA and what it is, what it does, and what their mission is?
Absolutely. So, STANA, or the Smell and Taste Association of North America, is a patient advocacy group focused on improving the lives of people who have smell and taste dysfunction. So, our vision is a world where smell and taste are valued as essential to our health, safety, and wellness. Because, as we've discussed in this conversation, they're not typically valued as essential to health, safety, and wellness. So, we really want to change that so that people appreciate the sense of smell and understand how important it is in our daily lives.
Also beyond that, yeah, you're creating like a community through this, but also developing tools, right, to provide people to use when they do have olfactory dysfunction, because it's not only anosmia but also a broader scope of chemosensory dysfunction, right?
Yeah, so that's our vision is, right, a world where smell and taste are valued as essential to health, safety, and wellness. But we have a very broad mission statement where we seek to do many different things. So, serving as a voice for people who have smell and taste disorders through education and public awareness. We collaborate with people who live with these disorders with other interested parties like healthcare professionals and institutions so that we can provide evidence-based education, resources, and networking opportunities. We talked about the importance of networking. We also advocate for funding and expansion of research on smell and taste disorders, sharing the patient's lived experience with all different kinds of stakeholders so they begin to understand how important it is. We want to promote effective and accessible diagnostic and treatment options. And then finally, partnering with organizations around the world who are aligned with our vision so that we can broaden our outreach because there are other patient advocacy groups around the world who have similar missions.
Who are some of the stakeholder communities that you reach?
So, working with like other researchers from research institutes or different universities around the country, getting connected with clinicians. One of the things that we really want to do is get connected with primary care physicians and like nurse practitioners, people outside the normal box of what you would think for a clinician, right? So, not just ENTs. Typically, when you have smell dysfunction, the first person you go to is your primary care physician. And that could be whether it's like a medical doctor or a nurse practitioner. That's usually the first person who sees these people. So we'd love to work more closely with these groups of clinicians so that we can really like spread awareness of how impactful these disorders are so that they know and they are armed with tools that they can have available to them to help these patients when they come across them in their office.